Hi, my name is Kim Rager, and I am a student at National American University in the Masters of Science of Nursing in the Leadership Administrative tract. And today I am presenting my capstone project proposal. And what I want to let you know about myself is I've been a nurse for 35 years. Started out as a diploma RN, and then I went on to get my bachelor's in healthcare management at NAU in their first program. And then more recently got my bachelor's in science in nursing, and now pursuing this master's of science in nursing as well. And the title of my project for today is going to be Rotating of Shift Work and Lifestyle Choices. Is there a link to cardiovascular disease? Currently, I am on assignment. It's an interim assignment as the Emergency Department Director in Elko, Nevada, which is where my project site is going to be. And this is a very huge area for gold mining, copper, and silver, but specifically the golds. And there's a lot of underground mining and as well as above ground. But it seems like underground mining seems to be more of a problem. A lot of shift work going on there. And as nurses, we all have felt the effects of that rotational shift work and the night shift being potentially very uncomfortable, disturbing, not restful, and causing a lot of difficulty with our lifestyles. And as I was here just less than a month, I noticed that there were several patients that were in their 20s and 30s that were having STEMIs, those life-killing cardiac events. There's a lot of cardiovascular disease on top of that are non-STEMIs, and then on top of that, pericarditis. Why are these young people having such horrible diseases of their cardiac system? And so I was talking with the cardiopulmonary director, and she suggested that maybe we should look at this and see if there's an effect that has to do with just the mining industry, or if it's something to do with their lifestyle choices. These are young men that are away from home, they have lots of money, some free time, but when they do have free time, they can't sleep. So they're using a lot of recreational diversions, whether that's chemicals, whether it's social habit changes, or whether it's the use of, illicit drugs, alcohol, tobacco, caffeine, prostitution, just not sleeping. There's a lot of methamphetamine use in this community, as well as marijuana is legal in Nevada, but we're finding that a lot of the marijuana is not pure marijuana, it's being laced with other drugs. So I'm trying to figure out what's going on with this whole system, and since the data is already being collected, because we are a cardiac interventional site, we do report data to the National Cardiovascular Data Registry, NCDR, and through that will be part of my project, is be using that data that's already been extrapolated by somebody else. But this is another person that's looking at just this individual site to see if there's an abnormality, if there's something that we can do, working with the mining industry to see if we can do something different in how they properly equip their new employees for how to manage this lifestyle. So basically I've told you what I want to do, where I want to do it, and who I want to do it with. So this will be a quantitative research because I'll be using secondary data that's already been collected. And I found a lot of research that determines that, rotational shift work is very difficult on the body, especially that sleep disturbances, not getting into the right circadian rhythm, eating at the wrong time. That's been another subject matter that I did find. And let me think what else we have on here. Population for Elko is 20,078, and it's been an 11% increase in the population in the last 5 years, 18.7% in the last 7 years. The median value of the home is over $200,000, and the average household income is greater than $76,000. So that was in 2019 information from the Elko, Nevada Daily Press. And so being that does say this is not a poverty-ridden community. NNRH, Northeastern Nevada Regional Hospital, is where I'm working, and currently that's the only facility healthcare hospital in this area. It's about 4 hours to Boise, Idaho, or to Twin Falls, Idaho, 4 hours to Reno, 6 hours to Salt Lake City. So everybody that needs to be transferred out of here has to be flown by air because the ground ambulances can't be gone that long. So what I'm going to use is first-hand account of a topic, and I'm doing that based on some secondary resources. I'm doing a lot of research as far as what could possibly be causing this, and then primary source data, which is already the data that's been gathered from these patients. And I'll be looking at 100% of the population that has been entered into this NCDR database. They're required to do 30 a month, or 100% of the population that has been eligible. And at this point, I don't have the exact numbers on that. I'm trying to get that, and I'll have that as soon as possible. My preceptor is working on getting me that data. There are no physical patients that are being involved in this study. It's strictly something that's being found on the computer or on paper. And I'll be looking for especially young males ages 20 to 40. We're seeing diseases that are normally seen in the 60 to 80-year-old population in that younger group. And then, let's see what else. Existing data. I said I'm going to use that NCDR database and other scholarly research articles pertaining to this topic. I found several relating to hypertension and coronary heart disease during both sleep extremes. If you sleep more than 6 hours to 8 hours, or if you sleep less than that, they both can be detrimental to your health. And as a quantitative data project, I'm focusing on specific data points. I'll be looking not only at the participant data points, such as age, gender, sex, things like that, but also their lifestyle habits that are being disclosed. I won't be disclosing anything that would be of illicit nature, and there will be nothing that establishes a connectivity between any research finding and a particular patient. So the project tool that I chose for this quantitative research was one that was presented by Cresswell and Cresswell in 2017. And their model states it should be an introduction, a literature review, methods, results, and discussion. I need to look more into the validity and the reliability of this, and that's what I'll be doing presently, working on that. I do have references that are scholarly articles from each of those subsections, and I'll be able to present those as we go forward. Thank you for taking the time to listen to me and to give consideration to this Capstone project research. It should be very valuable to this mining community, and I would love for the hospital to establish a relationship with the mining companies, and we could collaboratively work together to improve the health of their personnel if there is a correlation. If not, it's still great information, and it is something that maybe we could apply to another project going forward in the future. Again, thank you very much for consideration, and I hope you have a great day.